That kind of rampant spread of the virus in Brazil is something officials in Australia are trying to avoid. As Crystal Goomansingh reports, they're going to extremes to try to get an outbreak in the country's second largest city under control.
It's a pandemic, and it will kill thousands of people if it gets completely away from us.
It's a risk Australian leaders are not willing to take. COVID-19 infections in the state of Victoria hit levels not seen in months. To suppress the spread, a lockdown is being imposed on nearly 5 million people in Melbourne.
You know, it's like the iceberg analogy, isn't it? There's been a lot going on that we didn't know was there, and all of a sudden it's come to the surface and everyone's a bit freaked out about it.
199 cases were reported Tuesday. It may not seem like a lot, but it is for Australia. And infections are occurring through community transmission. For the first time since the Spanish flu, the border between Victoria and New South Wales has been closed. Only under special circumstances are people granted permission to cross.
This is, I know, further than we went last time, but we are in many respects in a more precarious, challenging and potentially tragic position.
In many countries, the pandemic is accelerating. Worldwide infections have increased by nearly 1 million in roughly a week. More than 200 scientists called on the World Health Organization to acknowledge the possibility the virus can be airborne, spread through tiny particles that linger in the air.
We acknowledge that there is emerging evidence in this field, as in all other fields, regarding the COVID-19 virus and pandemic. And therefore, we believe that we have to be open to this evidence.
As scientists continue to examine the virus and how it's most often spread, people are trying to stay virus-free. And for millions in Australia, that means staying at home. Crystal Goomansingh, Global News, London.